Good afternoon, it's Mayor Turner. I just wanted to update you on the numbers where we are. The Amarillo is at 3834, Lubbock is at 2620, Abilene is 1104, Angelo is 434, Midland is at 772. And if you go on the website, the state's website where it shows the map and shows Ector County, the number that they are showing is not correct. Because they are not putting in the probable. Like I talked about last week, there is a huge mix-up on the state level because some counties are posting one way, other counties are posting another. We are actually doing what the CDC requires, which is you report all of them as confirmed. But the health department has stepped them out as probables, but your confirmed number is the true number. Right now, Ector County is at 1,392, and there are more coming. Right now, unfortunately, Ector County Health Department is way behind trying to get caught up with all of the data entry. So we are trying to get them some help to be able to bring the numbers in a reasonable amount of time. But they are working very hard. Right now, we have 1,138 kit tests that are being, we're waiting on, they're pending. So part of that includes the ones that the city did last week on Tuesday and Thursday. We have received the first few from last Tuesday's. They were 12 positive, but we should hopefully have those towards the end of the week. As we talked, CPL is actually on a 10-day kind of where they step back, where they're trying to get caught up. So we're very concerned about how long it will take to get all of these tests. We don't know exactly when that date is, when they will be totally caught up, but that is what we're looking at. Somebody asked about Dr. Bartlett's cure. One of the things the doctors have said is it has to be proven scientifically, and that has not, has to go. It's like when a new drug comes out. It actually has to go, and they test it on blind. You know, some people they give them placebo. Some people get the medicine, and the hospitals are not actually using his. That is a choice that they have made, but that is one of the reasons that they have given me is it's not been tested on a national level. So talk a little bit about what's going on right now. Medical Center and Midland Memorial are diverting patients, but as they get more patients, they're getting some out when they can, but not sure how much longer they will be diverting. ORMC is still taking patients, but we've had 12 of the hospitals down by Brownsville. 10 out of the 12 are at full capacity. So many people are shipping their cases to other parts of Texas, and that is really still causing some problems. But last week we actually had 4 testings. The National Guard did 2, which they tested 168 and 173. Tuesdays for the city was 196, 196. So all of those tests are still pending, except for the few that we've received on ours. But with the problem with CPL, that is going to push these out for a while. And one of the biggest concerns we have is if you take a test and you're positive, by the time you get your test results back, which could take up to 10 days, odds are you're probably going to be almost past the illness. And so we are working on trying to find them other places to send them. The University of Texas in Austin, their medical center is also authorized, and they are working on that to be able to get some tests down there to get them back quickly. So I apologize for the video. Something happened over here. It was a wreck. And so their video quality has been a little off. The doctor said today, you know, there are a lot of drugs that are being talked about out there. Hydroxyquin, another one that we have here that we have some availability. What the drugs actually do is help your body to heal and help your body to get rid of the virus. It's a lot like Tamiflu is the analogy they used, that said, when you have the flu, you can take Tamiflu in that first little part of the window when you get it, and it helps your body heal. That's what these are doing. They will help the body heal, but the body itself has to do the healing. And so that's why they're talking about there's no real silver bullet. It depends upon the person, whether the person's has pre-existing conditions or not, and that is the concern. Talk a little bit about a couple of hot topics. I see a lot of stuff on Facebook, and everybody says, well, this is a conspiracy, and the numbers are all made up, and they're not real, and all that. I have seen the list. The list I've seen actually has names on it, so I cannot comment on names. But I've seen the names, and the cases are real. My biggest concern, I'll be honest with you, coronavirus is concerning, but most people that get it are going to be fine. They just have to stay home or they can spread it. My concern is what's going to happen in our community. We've already seen the governor take a step back and say, well, only 50% occupancy rate can go into restaurants, into stores, and things like that. Before, when we had the shutdown, a lot of businesses were okay because they had a chance to go ahead and build that. Everybody has a little bit of cash in the back just to get you through the tough times. Many businesses don't have that now. Many of the businesses, after he dropped it back to 50%, we saw a decrease in my restaurants. I've talked to 2 full-service restaurants, and I said, well, how you doing? And one of them, very popular restaurant here in Odessa, said, I think I've got 3 weeks left if we do not get some people back in here. And you're going to see that with all businesses across the city. We love it when they're open and when we can go to them. But unfortunately, if the numbers are down, that's going to hurt us economically. And we need employers right now. We need people to be hiring. With 16.5% unemployment, that's third in the state. So that's the biggest concern I have, seeing what were happening to the businesses. But also want to talk a little bit about the mask or mandate by the government. We were totally caught off guard. Usually we can get an idea that something's going to happen a few days before. You get a little hint here and there. We had no idea. And all of a sudden this comes out and says there's a mask mandate. I understand why he did it. I don't agree with the mandate. But unfortunately, when you see almost 1,400 cases, 11 deaths, we lost 2 over the weekend. We're not going to have our police out actively looking for people with masks that aren't wearing masks. But if they get a phone call, say a certain game room is not wearing masks, they can go out there. Because our police officers are doing a great job and they have a lot going on. And we don't want them to say, well, I don't need to stop this speeder because I've got to go here and write a ticket for a mask. So if they can work it in the schedule, they'll go over there. But if we don't get these cases to go down, we are going to have a problem with businesses. I don't want to see businesses close. I've known some of these people for over 25 years. These businesses have been open, and I'm sure it's the same way on retail and everything else. Part of it, wearing your mask, some people say, well, it takes my freedoms away. Well, if you look at it one way, that's true. But if the governor comes in here and clamps everything down again, it takes all of our freedoms away. That's what we don't want to do. When they were opening from 50% to 75% at a state level, there were counties that could not open and go to 75. The reason was Amarillo was surging, El Paso was surging, and those counties weren't allowed to open up anymore to the 75%. Guess what? The governor, I saw the interview with Jay Hendricks, very good interview. He talked about Midland County and Ector County, where things are going up. And, we just really have to be careful, make sure that we're doing what we can. because I don't want anybody to get this, but we are seeing the numbers climb. And some people say, well, 1392 is high, but that doesn't count all the people that have it in the community. Maybe a younger person thought they caught a cold or whatever. But I want us to be able to get out. I want us to be able to go back to where we were, but it's really in all of your hands. I can say whatever, but it's actually in your hands to be able to say, okay, I'm going to do what I need to for my community. Some people aren't, and that's their right not to. But I just want to ask, please, for your community, do what you can, and I will keep you in the loop and get you up to speed on Wednesday. That's when the next press conference is. I want to talk a little bit about the hospitals right before I finish. Medical Center has 38 employees that have been exposed and are home quarantining, which is a huge problem because many of both our hospitals need nurses. We've needed nurses for the last 10 years. Well, if we're taking those out, you're going to have a situation that Dr. Saravan told us about this week. They had a patient that had been sent home to a neighboring community, and they got a phone call and they had to bring that patient back because she had taken a turn for the worst, and they did not have a vent in her county. So ORMC took that. And you say, well, what do you do with a shortage of nurses? Protocol at ORMC is 1 nurse to 2 patients that are on a vent. Well, if you don't have enough nurses, what happens is you have 1 nurse for 4 vents. They really have to watch those people on events because typically they can go one way or the other fairly quickly. It's very invasive. They stick a tube down your throat and they're breathing for you. And that's what we're concerned about. Right now, ORMC has 9 staff out. Medical Center has 38 patients with COVID. And remember, they opened up a new floor, which is the 8th floor. And when they do that, they can't put anybody else up there because it is strictly a COVID floor. And so they have 518 tests that are pending. And they currently have 8 patients on a ventilator. ORMC has 14 patients, which is more than they've had so far. They have 9 on ventilators. They have 111 tests that are pending. So kind of gives you an idea where we are. The city will continue to do free testing. And so those dates will be on June 14th and June 16th. We are going to maybe change it up. It's going to be a drive-through test just to make sure everybody's social distancing. And so I will give you the details on that. God bless each and every one of you. Thank you for the encouraging words I see on there. Thank you. That means a lot. God bless each and every one of you. Please be safe. Make sure your family's staying safe. God bless each and every one of you. And I will talk to you on Wednesday. Thank you.